Hey, how you doing? My name is Diakon, and I'm going to be your nurse today. Can you tell me what your birthday and your name is? Alright, yes, and do you know if you have any allergies? No? Latex, betadine, iodine, shellfish? No? Alright then, well I asked that because today I checked your order before I came in, and the procedure that you're getting is, you're getting a Foley catheter, and how we're going to insert that is, it's going to go through your urethra and it's going to go to your bladder. And what that's going to do is going to help relieve your urine retention. It's going to ease up the pain. But before we start that, I have to perform hand hygiene. And then put some gloves on. Before we start this procedure, I'm going to have to do some perineal care, and what that is just going to do is just going to reduce the likelihood of you getting an infection down there during this whole procedure. But let's set a towel up here so you won't get any splashback or water on you. For perineal care, I'm going to get some hot water or warm water and soap, and then I'm just going to get this towel right here. For a female patient, I would spread and wipe the labia majora first, then get a different corner of the towel, the labia minora in a different corner of the towel, and one down the meatus. But if it was a male patient, I would start at the meatus, doing a downward spiral towards the shaft, all the way to the pubic region. Alright, then I'm going to take these gloves off. I'm going to throw these away. Alright, now I'm going to get your catheter kit. So pull it out. I'm going to use this as a trash bag. I'm just going to stuff it down in here. I'm going to position this. I'm going to open it outward, inside. This is going to be my sterile field. Alright, then I'm going to grab my sterile gloves. Go over here and put them on. And what I'm going to do is I'm just going to lay this on you. First, before I did that, I would make sure you're in dorsal recumbent, since you are a female. But if you're a male, you would just be in supine. And I'm going to move this. And right now I'm just going to get everything ready so it'll be an easier transition to put this in. This is 10 milliliters of saline, and what this is going to do is going to blow up the balloon on this catheter so it can stop it from the catheter falling out, and no one will have to hold it. Alright, I'm going to get this iodine right here. I'm going to put it all over these cotton balls so it can be clean. Got one. I'm going to spread. I'm going to wipe down one for the labia majora, one for the labia minora, and then one for the meatus. Alright, now I'm going to lube up the catheter. 2 to 3 inches. I'm just going to spread that open. Put it in 2 to 3 inches with my dominant hand. Then I'm gonna fill up the balloon with 10 milliliters of saline water so it won't fall out. Alright, now I'm gonna give it a little tug to make sure it's in. I'm gonna unsnap that. Alright, and now I'm just going to make sure put this bag on this bedside or hang it on the bed. And make sure that it stays below the bladder at all times. Then if I already collected a urine sample, I would get a syringe and with this and I'll pull it out, which would be a lot more sterile than me just going to the bag and pulling it out. But I could do either or, just depends on how sterile I need the sample to be. Alright. Now I'm just going to clean you up. I'm going to get a towel and just make sure all the betadine and iodine is cleaned up and let you dry. Grab this towel, I'm going to discard all of this, and I'm going to take my gloves off. I'm going to dispose of those. And if you are, since you're a female, I'm just going to tape it up. Tape the catheter to your leg. I would still have on my gloves. But if you're a male, I would just tape it to your abdomen, leaving a little slack within both of them so y'all can move easily. And then I'm just going to cover you back up. And I'll check on you in a few days. Hey, how you doing? My name is Diaquin, and I have an order to take out your Foley catheter. You're no longer holding your bladder is no longer holding all your urine in. Can you give me your name and birth date? Alright, do you have any allergies? No? Alright, great. What I'm going to do is I'm going to perform some hand hygiene. Put on some gloves. Pulling out the catheter won't be nearly as discomforting as putting it in, but you will feel a little bit of discomfort. I'm just going to put this towel right here so nothing will get on you. I'm going to grab my syringe to empty the balloon out of you so I can remove the catheter. Alright. And I'm going to pull this out. 1, 2, 3. Alright. But before I did that, I would have emptied out the bag that we have on the side of the bed. Wrap this up and discard this. Now I'm just going to clean up after and dry everything up. I'm just going to cover you back up. I'm going to return your bed to the lowest position possible.